It is now necessary to close this ellipse. Sometimes you may find that there is a lot of tension in the mid-portion of the ellipse. In these circumstances, it is helpful to undermine the subcutaneous tissue away from the skin edges. To close this ellipse, the best method is to place the first sutures at the distal edges, then gradually work towards the centre. If you try to start the closure at the widest part of the wound, you may find it difficult to bring the edges together. In this example, we will begin with a surgeon's knot, with the first throw jammed to one side. The next bite is placed at the opposite end of the wound and again tied using a surgeon's knot. The wound is closed with interrupted sutures, working towards the centre so that you are left with the two wound edges approximated in a straight line.